successful firms and developing future leaders. Hone their expertise. As one of the best private universities in Indonesia, nationally accredited and internationally well-known, we've earned the distinction of being the third-ranked higher education institution in Jakarta for our impact on the Sustainable Development Goals, giving you the experience to be part of a global collaboration with various partners and universities on a national and international level. Universitas Yarsi is a place where education, research, and community development as the main pillars of higher education are upheld and carried out, encouraging you to be a smart, active, and inventive young intellectual with a strong sense of problem-solving and empathy. A place where art, technological innovation, culture, and diversity come together with Islamic values in a way that inspires and opens new windows to the world. A place where modernization, driven by the rapid advancement of the educational sector and technology, provides you with the best means to stay connected to various learning processes both on and off the network. The technology that runs along the traditions of Nusantara while upholding the Islamic values. In this place, where knowledge meets passion and dreams come true, at Universitas Yarsi, the pursuit of knowledge extends beyond the confines of the lecture hall, turning into an adventurous journey with each chapter unfolding, a place where individuals are free to explore and express themselves, optimize their talents and creativity, and leverage all the opportunities and resources available to support them in exploring knowledge, both theoretically in the study room and practically in the state-of-the-art and modern research room, to the social and professional environment as a form of social responsibility and self-actualization of every element Universitas Yarsi to spread benefits, advance, and educate the nation. A place where individuals are also nurtured to reach their full potential, equipped with Islamic knowledge, skills, and capabilities to face various global challenges and competition, a process that molds an excellent young generation. Insan Kamil, who not only excels academically, but also actively contributes to solving global issues and challenges.
Universitas Yarsi bertekad untuk melahirkan sumber daya manusia yang tidak hanya unggul di dalam ilmu pengetahuan, teknologi, dan seni, tapi juga dibekali dengan keimanan dan ketakwaan kepada Allah Subhanahu wa Ta'ala, di samping juga cakap, mandiri, inovatif, serta siap menjadi warga negara yang bertanggung jawab untuk kemajuan umat, bangsa, dan negara Indonesia tercinta.
Yayasan Yarsi berkomitmen penuh mendukung Universitas Yarsi dalam rangka mewujudkan perguruan tinggi Islam yang terpandang, berwibawa, bermutu tinggi, dan mampu bersaing dalam forum nasional maupun internasional. Yayasan Yarsi mendukung sepenuhnya kegiatan pendidikan, penelitian, dan pengabdian kepada masyarakat sehingga dapat diwujudkan masyarakat yang sejahtera, adil, dan makmur.
This is a place where you can begin to shape your dreams and goals, bringing them to fruition until you achieve the highest peak of success you have always dreamed of. A place you can rely on to support you in achieving all your hopes, transforming you into an excellent young generation who are ready to rebuild the glory of Islam and make Indonesia advanced and strong. Here at Universitas Yarsi, the smart campus that you can rely on.
began with a great dream to found a hospital with first-class service to the community. The Yarsi Foundation has made this a reality. The Yarsi Hospital, which runs according to Sharia principles, is located in the heart of the capital on Jalan Letnan Suprapto, Cempaka Putih, central Jakarta. The Yarsi Hospital has complete and modern facilities to offer first-class service to its patients. There are 450 beds for inpatient treatment, divided into 6 classes from third class to presidential suites. In addition, the hospital offers guest house accommodation for 19 families of patients. Outpatient services are provided by 35 polyclinics on the 3rd floor, and 15 more in the annex building. For dental patients, the hospital has 10 exclusive clinics and 80 regular clinics. A research and histopathology center further supports medical treatment and development.
Visi yaitu memberikan pelayanan terbaik, terunggul dan komprehensif kepada masyarakat pengguna sesuai dengan Islam. Dan misinya pertama adalah memberikan pelayanan kesehatan, yang kedua melakukan penelitian yang mendukung pelayanan tadi, dan yang ketiga adalah memberikan pendidikan kepada mahasiswa.
The Yarsi Hospital is committed to providing the best service to patients who require surgical facilities. The Yarsi Hospital in Jakarta has 5 central operating rooms, 1 emergency operating room, and 1 obstetric and gynecology operating room for maternity patients. In addition, an isolation ward is available on level 5 for patients who have contagious conditions or who may be vulnerable to infection.
Rumah Sakit Yarsi dipersiapkan sebagai rumah sakit pendidikan Fakultas Kedokteran Universitas Yarsi, menjadikan Rumah Sakit Yarsi sebagai sarana pendidikan dan penelitian buat kedokteran Indonesia.
Aspiring to become the referral of choice at the national level, the Yarsi Hospital is supported by leading technology and uses the latest high-tech medical innovations. The Yarsi Hospital in Jakarta uses an integrated information technology system to link all its units in offering fast, paperless service.
Harapan saya dengan adanya Rumah Sakit Yarsi ini adalah agar Rumah Sakit Yarsi dapat menjadi rumah sakit yang bernuansa Islami dan berstandar world class.
The Yarsi Hospital in Jakarta has facilities for an air ambulance in the form of a rooftop helipad for emergency cases. The emergency room includes an acute trauma center with 20 beds and its own operating room. Maximal service for patients who require surgery is a priority. Using minimally invasive technology, including in radiological, vascular, neurological, and cardiac interventions. For patients undergoing minor procedures, the Yarsi Hospital offers day surgery facilities for procedures where overnight stay is not required. The Yarsi Hospital, run on the principles of Sharia, is ready to serve the public in a friendly and professional manner, such that Indonesian citizens do not need to leave the country to obtain the best medical services possible.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah. Thank you for everyone to attending this discussion and also expert lecture from Dr. John Lay. Allow me to introduce, I'm Dr. Diki Budiman as the Master of Ceremony and also has become the next will be the moderator for this session. Thank you, Professor Chandra and Dr. Mulyadi, and also, of course, our dear student to attend this very, I think it will be insightful moment from our colleagues in here, Dr. John. And of course, first, I would like to invite Professor Chandra to give remarks and also opening speech for today discussion. Please, Pak.
Sebenarnya nggak usah pakai resmi-resmian lah ya gitu ya. Assalamualaikum warahmatullahi wabarakatuh. Jadi, so I will speak in bahasa Pak John ya. Jadi teman-teman kita selalu mencoba kalau selain pelajaran yang di kelas begitu, mencoba mengambil pengalaman dari luar. Dulu waktu baru-baru mulai, saya minta Dr. Diki ini waktu dia masih di Australia untuk bicara lewat Zoom. Waktu itu ada yang dari Australia, ada yang dari Jenewa, ada yang dari mana lewat Zoom gitu. Jadi supaya kita dapat gambaran lah apa yang terjadi di rumah sakit di beberapa negara. Kemudian beberapa waktu yang lalu saya undang orang dari Amerika untuk bicara tapi by apa namanya itu? Radio lah ya, artinya nggak di depan kelas seperti ini. Nah, kemudian I met him firstly maybe 200 years ago. Yeah? When I was still in the Ministry of Health, so we met again and okay, 14 years. And you know, formally in English we have to call him Dr. Lay, of course. We have to call people by family name, but in Indonesia we use the first name. So it's become John. And usually if it is John, then we have to call him just John. But in Indonesia we cannot call people by name, so I call him Pak John, which is quite weird for him, but he has to accept that that is the Indonesian way. So I met him several times this time. So he was the, I don't know, the chair of the leader of the Australia-Indonesia Health Security Partnership. So that was an organization, Australia-Indonesia Health Security Partnership. I was also involved in that organization in One Health. But then I talked to him and I said, could you kindly share your experience? My first request to him, could you kindly share your experience become a patient or handling hospital in Australia? And he said, no. I have Australian experience, but I have experience in other countries as well. So that's why we are very fortunate now. He will share with us experience of hospital services in how many countries, Pak? 198 countries. 198 is a number of countries belong to WHO. WHO member is 198, but he will share with us hospital experience in several countries. So thank you, Pak John. And welcome to this Universitas Yarsi. So this is one of the class of the hospital administration management. But we have also colleague from the hospital itself, the director and colleague, the manager of the hospital. You can see that hospital even nicer than the university. And at least if you come to this Yarsi building, you will see in front of us the hospital. But so thank you. I also invite somebody from Rumah Sakit Gigi Mulut. Ada yang datang ya? Belum ya? Okay. So actually, there are two hospitals here. One is the hospital, the director, Dr. Miyadi, that the big one. But there's another, what do you call it? Dentistry hospital as well. Yeah, dentistry hospital. So there are two hospitals. But so this is the third. I mean, yeah, we just opened about 2 years ago. So not yet graduate. So the first graduation will be next year. So they are about to graduate. So that's why they are coming to listen to your lecture. Jadi terima kasih teman-teman sudah hadir. Kita akan dengarkan apa yang Pak John sampaikan dan saya yakin akan bermanfaat. So thank you very much Pak John. Thank you very much colleagues. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih. Thank you, Prof. Chandra. I used to because I work with Prof. Chandra in Ministry of Health for many years, and also the first time I met Dr. John Lay in Sydney 14 years ago, when I was also with Prof. Chandra and also our minister at that time. Thank you. Now I changed my position, become the moderator for this session. So I'm honored to become the moderator for this very important and also invaluable session. First, of course, I would like to introduce Dr. John Late. Could you just show us? So allow me to just summarize because I know the real experience of him is so long, and also he has the remarkable working experience in many countries and lead many, especially UK government mission for health in several countries, including in Africa and also, of course, in Asia, also in Southeast Asia, Cambodia, Vietnam, and also, of course, China, including, and also, of course, Indonesia. And today we will, of course, we will hear from him about these comparative, hospital services. Before we start to Dr. John, YARSI is Islamic also university, and we have this Sharia rule, and in Islam, seeking knowledge is very, very important, and also we call it wajib, and one of timeless wisdom from our Prophet Muhammad sallallahu alaihi wasallam say that you have to seeking knowledge even as far as China. So I hope utulbul ilmi walau bishin. So I hope Pak John will, of course I will say Pak John will also share with us the China experience on hospital. Without further ado, please Pak John, the floor is yours. Thank you.
Okay, thank you very much and good morning everybody. Assalamualaikum. Thank you very much Prof. Chandra and Dr. Buddhi and colleagues, yes, and students. First of all, let me give you a kind of a health warning. I'm not an expert on hospitals. Let me say that up front. I have worked on health systems in many countries, and I'll talk a little bit about that. And that has included, where does the hospital sit within the health system and so on. But I'm certainly not an expert on hospital management. Most of you probably know more about hospital management than I do. But what I want to talk about today is, first of all, I will go through some comparative statistics about the health sector in a number of countries, including countries where I have worked, and look at some of those differences and similarities. And I hope, when you're thinking about hospital management and when you're thinking about your role in a hospital and in the broader health sector, that you would also think about, other countries' experience, and I will share some of that today, and, whether we can learn something from other countries, and also sort of digging into the reasons why things are different in different countries. And from some of the statistics, I think you will see there are some things which are quite obvious. There are some other things which are not quite so obvious. And then we need to start asking, why is it like this? And why is it like that? And then apply that to our situation in Indonesia. Why is it like this, When I saw your video just now about, I have not yet had the privilege to visit your hospital, but it looks a wonderful hospital. And I have been to a number of hospitals in Indonesia, including private sector and public sector. And I think, as you all know, they're not the same thing at all, right? So I have not been to your hospitals, but I have been to Siloam hospitals, Medistra, the Pondok Indah hospitals, or some private hospitals which clearly have, really good facilities, well managed, and, you just look at it and you can say, this could be, a hospital in Singapore or a hospital in Europe. When you look inside the facility, that's what it looks like, right? If you go to a government hospital, it's a different story, right? Yeah, it's different, right? They may have very, very good professional doctors and other staff, but when you just look at the facility, you think, this is a different world altogether, right? So, when we think about hospital management in Indonesia, we have to think about both, because not everybody is going to go to these, really, really top hospitals. For a lot of the population of Indonesia, that's not really an option, right? And they have to deal with what they get at the public hospital. And, we all need to think about how we can improve what everybody gets, right? Not just the people who have access to the really good hospitals, but also what about the people who have to, they don't have any choice really. They have to go to the local district hospital or whatever it is, right? And so how can we improve those? Because I think one of the differences that you will see between a number of the different countries that we're going to look at, and I will share a few statistics. If you go, for instance, my home country, I'm not Australian, I'm actually British. Nowadays my home is in Australia, I have my house there and everything, but I am actually British, but I have a permanent residency in Australia. And if you go to a hospital in Australia, or if you go to a hospital in the UK, whether it's a public hospital or whether it's a private hospital, it's not easy to tell the difference. The management and the financing may be different, but the facility basically the same. You can't tell the difference, and in fact, very often the public hospital is a better one. Certainly in Australia. I have seen in Melbourne, in Australia, some of the public hospitals in Melbourne, they are the best hospitals, really. They completely outrank the private hospitals in terms of the facilities and everything that they have. But when you come to middle-income country like Indonesia, or low-income country like I have worked in some countries in Africa, which are low-income countries, the difference between the private hospital, which is internationally competitive, and the public hospital is stark. It is really stark. I can tell you stories about a hospital that I went to, for instance, in northern Nigeria a few years ago. I was working in Nigeria, and up in the north of Nigeria, which is the poorer part of the country, I went to a district hospital there. I mean, it is just basically a bare shell of a building with some beds in it. And this is supposed to be a district hospital, They have an operating theater, which is just a room off the corridor separated with a curtain. That's it. And doctors are very good doctors, actually, and operating, but in what conditions? There is, how do you manage infection control in that kind of environment? I mean, it's very, very challenging, right? But that's what they have, right? Indonesia is obviously much better than that. But you still see the difference, right, between your typical, if you go to a district hospital, and then it depends on the district. I have been to district hospitals in Bali or in Yogyakarta, which are actually not bad. I have been to district hospital in Papua, different story. Very different story, So there is a lot of variation even across the country. Maybe we can look at a couple of the slides just to get the background of the setting of the health systems in different countries. Can I have the first next slide, please? Yeah. So there are a number of rankings that are done of health systems generally, right? The most definitive one was done by WHO, but it's quite old now, right? It was the ranking done in 2020. WHO has not really done that again. So ranking 191 countries, these are some of the countries that I have talked about, which are relevant countries or which I have worked in, actually, right? So in general, at the top of the list, you get a lot of European countries. Typically the European countries, I haven't listed them all here, but members of the European Union and some of the nearby countries, they are typically in the top rank. The UK, which prides itself on the National Health Service and all of that, okay, thanks. Thank you. Is ranked only number 18, right? I'm sure, you know, a lot of people in the UK would think, oh no, we have the best health system in the world. But actually, according to WHO, it's only number 18, right? I think Norway in that ranking. But there are several European countries that rank very high. Norway, Denmark, Netherlands, the Scandinavian countries, and noticeably, Singapore. Singapore also ranks very highly, right? Then Australia, this is back in 2020, was only down at number 32, right? So again, you know, there are countries, quite a lot of countries doing better than Australia in terms of this very scientific ranking that WHO did for the whole health system. United States, again, a little bit further down the list. And I don't know if you've done much comparative studies of health systems around the world, but the United States health system is well known to be one of the most inefficient in the world. They have a very high standard of service that's available, but the question is, how do you get access? Unless you have money or private health insurance, you can't get it, right? It's a very expensive. We'll see some of the financial statistics in a moment. Very, very, very expensive health system in the US. And according to the WHO, it only ranked like number 37 in the world, right? And then interestingly, one of the higher ranking countries in Asia is Thailand, and has been consistently. And then Indonesia was down at 92, like in the middle. This is out of 191 countries. So So 92. Halfway up the list, right? India much further down. Sorry. China, interestingly, back in 2020 was way down, right? A very poorly performing country on average. Tanzania, a very poor country in Africa where I was working not long ago, you can understand it would be quite low ranked. Vietnam also was quite low, near the bottom of the list, and right at the bottom, Nigeria. Even though Nigeria has more money, Nigeria is a lot richer than Tanzania. Tanzania is a poor country, still very much a low income country. Whereas Nigeria is a middle income country. They have a lot of money from oil, but the quality of their services is still very, very poor. Now, come forward to this year. The WHO has not done an update, but there's Numbeo is a company that does a number of surveys around the world based on a number of indicators, so it is quite scientifically based, but it also includes public perception. So it might not be quite as scientific as WHO, but it is still based on good evidence and they do a number of different indicators, including public perceptions of the health service. And interestingly, look where Thailand has come to now. Thailand is a country which is similar income to Indonesia, upper middle income country, and yet they are ranked now, according to this latest ranking, up to number 10 in the world. It's still not up to with some of the European countries or Singapore, but still very, very good performance in Thailand. And we will see from some of the financial information why some of that might be the case. The UK is still about the same level, 18, 19. Australia come up a bit over these last 20, 25 years. China, major improvement, right? Now, I was working in China around about 2007 to 2011, 11, something like that. I was in China for about 4 years. And during that time, they were starting to implement a major health sector reform. And they have followed through with that. You know, in China, when they plan to do something, they do it. You know, that's not always the case. You know, we know in Indonesia, even in Australia, you know, you plan something, it doesn't always happen the way you plan. But in China, you know, they have what we call a totalitarian government, right? The government is all powerful. You don't disagree with the government, please. You know, if you disagree with the government, if you are a Chinese citizen, maybe you will be in labor camp for 20 years. You know, you cannot disagree with the government. So what they do, what they say they will do it, right? And they planned out their reforms. We helped them with that. At the time I was working with the British government, we were providing them with some health economics expertise as to how to plan out their national health security and the social security for health, like the BPJS we have here, right? So their health insurance. And they are implementing it, only they are implementing it a little bit ahead of schedule, which is again very typical for China, right? In China, they plan to build a railway in 2 years and they build it in 1 year. You know, that's the kind of thing in China, right? And the same with the health sector reform. They have moved ahead with health sector reform, so their ranking has come from one of the lowest ranked countries to one of the sort of top quartile countries. So that's really good. So this is actually only out of 94 countries ranked here. So there are countries like Tanzania, which is not ranked. United States still around the same level now. So interesting to see, you know, countries like Thailand and China are ranked better than the United States. Then India has come up a long way, and Vietnam has come up a long way. Indonesia is still sort of around the middle, right? Still around the middle, not improved as much as some of these other countries, right? So that's also interesting, and we might want to think about, you know, why that is the case. Nigeria is still at the bottom of the heap, despite the fact that they are getting more and more resources from the oil. They are not a poor country, but unfortunately, you know, with the corruption and the misuse of resources and so on, the health services are still extremely poor. Do you have any idea of Malaysia? Malaysia, generally, I didn't put them on the list because I have never worked in Malaysia, and I've actually only ever visited Kuala Lumpur once, I think. So I don't know much about Malaysia, but generally in the rankings, they're a little bit above Indonesia. Not much, but a little bit above Indonesia. I have more statistics, so shall I do this? Does this move the slide or? Yeah, there we go. So now let's look at some of the financial things, which gives us a little bit of an insight. Total health expenditure as a percentage of the GDP, right? So the GDP of a country and the total health expenditure, that's everybody. That's out-of-pocket expenditure, that's government expenditure, it's health insurance expenditure, and everything added together as a percentage of the country's GDP. Now, there's a lot of different lines there, a little bit confusing. You have to go by the color, because I think at the end there, the label's not quite aligned with the lines. But you can see, actually, with the countries that I have listed here, you know, China, Thailand, Nigeria, Indonesia, India, Tanzania, and that's Vietnam. They're not huge differences, actually, and given the health system performance that we just looked at, perhaps the results are not what we would expect, right? You would think, okay, people spend a lot of money on health, so they have a better health system and they have better health results, but that's obviously not the case. Nigeria, they spend quite a lot of money on health, but obviously not with much result, right? Vietnam has actually sort of gone along at a sort of steady level, not much change, but the performance of the system has improved a lot, right? Indonesia also sort of come up a bit. Indonesia actually started very low. As you see, Indonesia is the dark blue line here. So Indonesia started back in 2020 as very low health expenditure. Indonesia is the dark blue, and then it goes up, right? So that's why the label is there, right? Because the top blue line is China, and the very light blue is Tanzania. So I don't know what happened to Tanzania in 2006. They spent so much money on health. I haven't really studied what happened there, but now they are back down again, right? So Indonesia recently, in just the last few years, come up, right? But it was very low, right? And that's then adding into the same chart the average for the upper middle income countries. So Indonesia is now an upper middle income country, and that's the average. So all of these countries, some of which are upper middle income, so China, Thailand, Nigeria, Indonesia, not the others, are all now upper middle income countries, and yet spending less on health than the average for upper middle income countries. That's quite interesting. Yeah. So total health expenditure does not seem to be a good indicator, right? How much everybody altogether, the government and the population are spending, all put together, doesn't actually seem to correlate very well with the health outcomes and the performance of the health system. That's quite interesting. Now, you add in the richer countries, and you say different. This is the same numbers, but they come in much higher up, right? So huge expenditures in Australia and the UK, and the United States almost off the chart, right? This is as a percentage of the GDP. The United States has the highest GDP in the world. And the percentage is the highest. So imagine how much they are spending on health. It's mind-boggling, right? It is up now around 16% of the GDP. I mean, it's mind-boggling. They spend so much on health, and yet the performance of the health system is just average. Really, it's not better. And European countries, which spend actually less, have much better health systems, right? So this is very interesting. So we can learn something about some countries that we should copy, and some countries probably we should not copy, right? But it's interesting. In general, the richer countries have much bigger expenditure. So that's the OECD. Whereas the US is way above, right? But compared then to all of these middle-income countries or low-income countries like Tanzania, there's quite a big difference there. Let's go on. Next slide. I think this is not working. Yeah, sure. For this chart, that was the first. Yeah, can we go? No, this has gone too far. Can we go back? Okay. Let's see. Where are we? Where did we get to? This is still there. We got to here, yeah. But you are mentioning the first one, I think, right? So the ranking. Okay. So WHO has a very scientific ranking which has a lot of indicators in there. It includes hospital performance. It includes public health performance. It includes health outcomes. They have a basket of, I think, you are the WHO expert, sir. But I think about 20 indicators are in there. Things like maternal mortality, infant mortality, so there are health outcome indicators. There are efficiency indicators in terms of how much you get for your money. And so there's a whole basket of indicators in there. The number one is a bit simpler, using a smaller number of indicators, but as I said, also public perceptions. So they do like surveys and find out how satisfied people are with the health services. So that is added in to that, which I don't think WHO includes, but Numbeo includes that. So there are a number of rankings. There are these of the latest ones that are done every year. Numbeo is the one that I chose, but there are a couple of other global systems where they use rankings. The results are by and large pretty similar across the different organizations that do the rankings, actually. Okay, so let's, we did this. Now, the next indicator, government health expenditure as a percentage of the total health expenditure. So we looked at the health expenditure related to the GDP. This is now, how much is the government spending out of all of the money that is spent on health, because there's out-of-pocket expenditure, there's also health insurance expenditure. Now, health insurance might be from the government, right? So that's included in government expenditure. Like here, the BPJS money, for instance, is part of the government budget. So that's included in the government expenditure. But in some countries, like with the classic example for a health insurance finance system is Germany, but there are other European countries and other countries around the world that follow that, where a large part of the health expenditure comes from health insurance, which is not funded by the government. It is funded by employers and employees. So that's the German system, which has been copied in a number of other countries. But this is government expenditure through whatever means, either by direct expenditure, like say in the UK's National Health Service, which pays everything directly from the government, or in Indonesia, where it's a combination. You have the Ministry of Health directly funding health services, but you also have a large part of the Ministry of Health budget going to the BPJS through health insurance. So you combine them both in Indonesia, right? So this is what it looks like. So typically in the African countries, and Nigeria and Tanzania are the two which I have here, it's lower, right? And then Thailand, interestingly, and remember, Thailand's performance has improved the most spectacularly. The proportion is quite high. So you see the numbers here, I don't know if you can read from over there. It is like 70%. This is the scale here goes from 10 to 80. So it's a big range, right? It's not like we were looking at, you know, as between 5 and 6% or whatever for the total health expenditure as part of GDP. This is a big range. So you're going from Nigeria, which is less than 10%, up to Thailand, which is 70%. So there's a very big difference in how healthcare is financed in different countries. And interestingly, one of the most interesting ones here is Indonesia. Look at where Indonesia is. It was running along about 30%. And since 2010, has been going steadily up. And the proportion of health financing in Indonesia that is provided by the government is now more than half. And that's quite a significant change, right? It's a big change, right? You see a similar pattern in China. They did it earlier, right? So China is the lighter blue there, which started again around the same as Indonesia, around 20%. And they were steadily increasing up to about 2014 and 2015, which was part of the reforms that I was mentioning about earlier when I was in China during that period. And since then it has plateaued because they reached the level that they wanted to attain. Indonesia, we're still going up, actually, still going up. This data is up to 2020. And the latest statistics I saw is that, you know, it's gone up even more since then. But then when you get to 2020, 2021, it's a little bit difficult. So I have not included all of those statistics, and they are not available from every country anyway. But you know what happened in 2020, right? 2020, we had COVID, right? 2020, 2021, we had COVID. And that upset a lot of health financing in a lot of different countries. And one of the things that it did in Indonesia is actually increase the health spending a lot. And even after COVID, Pak Budi, the current health minister, has been quite effective in getting more money out of the government. So he's actually continued to increase the health budget. So Indonesia is very much on the up and up in terms of the proportion of health spending that comes from the government, which is moving, towards the pattern that you see in many more developed countries. Now, same graph, but putting in the high-income countries. Now, what you see here is interesting. The UK and Australia are steady, and they have always been at that level for many, many years. But it is where Thailand has now reached, right? Which could also be an indication of why Thailand's health system is actually so good for a middle-income country. They have 80% or 70% of their health expenditure, total health expenditure, coming from the government. The highest is the UK, and of course the UK prides itself in the national health system. It might not be a perfect system. I'm British, and most British people will say it's a perfect system. But I think, once you have a lot of experience with the national health system, you understand it's not a perfect system. The weakness of that system, and I'm sure I don't know if you've studied this as part of your studies, but, basically, there are lots of variations on ways health systems are financed, but basically you come to three ways, really. One is state-funded, one is private funded, and one is the health insurance funded, right? Now, health insurance can be, as I said earlier, can be funded from different sources, right? In Germany, it's funded mostly by employers and employees. In some countries, it's state-funded health insurance, as it is mostly in Indonesia. But in the UK, that's not the case. In the UK, it's only the very rich who use health insurance. The NHS, the National Health Service in the UK, is free for all. There are a few charges that you pay, small charges, but they go nowhere near covering the cost. So it's basically entirely government funded. Now, the problem with that is you're going to fund everything from the government. Where's the limit? The demand very quickly outstrips the supply because even the richest countries in the world can't afford everything. You can't afford to provide absolutely first-class healthcare with all the facilities for all of the diseases, some of which are very expensive to treat. You cannot provide them all to everybody all the time. No government has that much money, not even the richest countries, right? So that's the problem with the NHS in the UK. You get into some kind of a rationing system with long waiting lists because people, there are not enough services to meet the demand. So yes, it's free, but you might have to come back after 18 months to get your treatment, right? If it's not an emergency. If it's an emergency, they will cover it, but there are still now, increasingly you get the press coverage in the UK about the long waiting in hospitals, ambulances queuing up, even patients dying in the ambulances whilst they're waiting to get into the hospital because the service can't keep up with the demand because it is all paid for by the government and free for everybody. So if you get sick, you go to the hospital, you get treatment. It's free. And until recently was free for everybody, regardless of whether you are a British citizen. So an interesting fact, which is now the government, the last government has kind of clamped down on that a little bit. It still happens somewhat. There was an interesting phenomenon happening on quite a big scale that Americans, because of the huge cost of their health services in America, found it cheaper to fly to the UK to get treatment and then fly back to America. And there was no restriction to stop them from doing that. They just used the National Health Service in the UK. Now it is being more restricted. So non-residents do not automatically get everything for free, but it used to be the case. So that's a problem when you are up at that high level of, more than 80% of your health expenditure is from the government. That becomes a problem because you cannot provide all of that, right? You need to have some form of rationing. Health insurance is more efficient in that respect. Australia has a combination, as does China. I was working in China when they were working through the reforms of the health system, and they actually decided what they called in interesting Chinese speak. They said, "We will go for German jacket and British trousers." So that the top is German and the bottom is British. So basically what they said was the basis of their health financing system in in China is going to be based on the German model of employer-employee paid health insurance. But there is a very large informal sector, same as in Indonesia, right? There's a very large informal sector, non-regulated largely. How are you going to collect health insurance payments from them? That's a challenge also in Indonesia, right? If the payments are voluntary, typically people who don't have a lot of money are not going to pay upfront insurance payments. They're more interested in buying the next meal, getting their kids into school, and so on. They're not going to pay upfront insurance if they don't have a lot of money. Same issue in China, right? So China decided, okay, so for those people, we have a different system based on the British system, free for all. But you have it means tested. So if your income is above a certain level, you don't get that. If you're above a certain level of income, you are going to have to pay national health insurance, and you get everything covered by insurance. And if your income is below a certain level, you get free services, but those services are rationed. So that's also another issue, and slightly different from when the BPJS was set up in Indonesia. I was here in 2011, 2012, when they were finalizing their national health insurance of the BPJS. One of the discussions was, how much are you going to cover? Are you going to cover everything? And at the time, the thinking was, yes, we will cover everything. And some of us were saying that's actually probably not very wise, because a lot of procedures can be very, very, very expensive, and only a small proportion of the population are going to use those, but you're spending most of your money on those things. And that is actually what is happening with the BPJS. A lot of money is going into a lot of expensive procedures which benefit very few people. And it's nice that they can have those things, but is that the best way to go? China decided to go on a different route. China decided, we will go wide, but not deep. So what they said is, we will provide health cover for everybody, for the 1.3 billion people in China, which is quite a challenge, being the world's most populous nation, or maybe just overtaken by India now, but one of the world's most populous countries, and covering health insurance or health care for everybody. But not every procedure is covered. And they have a list. And they have a list of all the procedures that are going to be covered. And they said, as the years proceed, as we go through, in the next 10 years, 20 years, 30 years, we will keep reviewing it, and if we have the budget, we will add more to the list. But we start with a smaller list. And then they prioritized very sensibly, first of all, everything for children. Everything for children is free in China. But then for the adults, there are lists of things that you can get or you can't get. And some of the more expensive treatments, if you don't have health insurance, you don't get it. Health insurance will cover it, but only up to a certain amount. If you don't have health insurance, you don't get it. But other things you'll get. So they are more thoughtful about rationing and thinking ahead and what the budget implications would be. But you can see that during that period, they did increase by a large amount, going up from 20% to 60%, or between 50 and 60% of expenditure in China went into health care from the government side. And of course, a large proportion of expenditure always goes into hospitals. That is for sure, in any country. In any country. The WHO and others very much encouraging people to spend more on prevention and promotion, which is great. and Pak Budi, our current minister, he gets that, and he's very much about, we need to be spending more on prevention and health promotion rather than having to deal with the treatment, because in the long term, it's much more cost effective, right? But at the same time, you can't stop funding hospitals, and people need the treatment, and you have to fund the treatment. But the question is, how can you spend a bit more money on prevention and promotion, and doing things that are going to be much more effective in improving the population health, some of which we know is very controversial and difficult, like stopping smoking, for instance. It's a controversial issue. It's hard to achieve. Right? Some health ministers have tried to take on that battle, and they have not really done very well with that. Australia has a much better track record in that respect. Australia decided politically, it's a political decision, right? The health, is obvious. From the health perspective, stop smoking, right? Do everything you can to stop people from smoking. But politically, you're dealing with industries and so on, who are making money out of it and all the rest of it. How do you deal with that? Australia decided to bite the bullet and say, we'll go for this. So what did they? They did two things. They went for aggressive advertising and regulation. So in Australia, if you buy a packet of cigarettes, there's no branding. They're not allowed to brand, and you have these horrible pictures of this and that. Well, Indonesia has done a little bit of that, but the biggest thing was the tax. Australia slapped massive taxes on to tobacco, and the objective of that is you stop the young people, right? The old people, okay, they're already smoking, they're going to smoke, right? Very few people can give up. They do sometimes, but most people don't give up. But for the young people, smoking, fun thing to do, my friends are smoking, I should smoke, and everybody is smoking. But when you have to pay more for your cigarettes than you do for your food, you start to think, maybe I shouldn't be spending this money, So you put in so much tax that it becomes prohibitive, right? So that's really what Australia did. So, we can put more money into prevention and promotion, but it's still not going to be what we spend on hospitals, right? Hospitals are still going to absorb a large part of the money, always. Government health expenditure as percentage of total government expenditure. Okay, now this is another statistic, right? So out of the total government budget, how much is going to health? And there's a lot of variation here, right? But again, you see, some countries which are doing consistently better, like Thailand, where they are spending, for the last several years, consistently around 12% of the national budget goes on health. China, somewhat less, around about 8%, right? Indonesia, as I mentioned, has been increasing, right? It's started off down, it's not working, started off down here around 4%, right? And now up there, almost reaching what Thailand is spending, almost 12%, right? So, from my perspective, having worked in a lot of these different countries, what Indonesia is doing is fantastic, really. The government taking more of the burden. When I was working here before, a decade ago, we used to say that Indonesia is a bit of an outlier, spending so little on health. That has changed. Indonesia has caught up, and is spending now a lot of the government budget on health, and continuing to do so thanks to Pak Budi. But his predecessors also were doing the same thing. Ibu Nav, Ibu Nila, they were and started probably from Ibu Endang. Yes, really getting the political profile of the health sector and getting more money for health, and which is good. All the sort of top global health economists will tell you that if you're going to rely on out-of-pocket expenditure, don't expect to get your health outcomes improved. It doesn't happen. The government has to invest. Health is a public good, and if you are dependent on just people spending money out of their pocket, number one, they don't spend up front. They will only spend when they get sick, and they will only spend it on themselves. Whereas the government is spending the money, they will spend more money up front on things to do with prevention and promotion. They will make sure that the services are more efficient, and they will also make sure that there is a continuity, and that the services that are provided are not just benefiting individuals, but benefiting the entire community. Health is a public good, right? So in many ways, when your health is better, that is positively impacting other people as well. You are not spreading diseases, right? If you get vaccinated, that helps to bring us up to herd immunity and so on. So and it applies to many different areas of health, and particularly the health of women. This has been shown globally through several studies, that when women have better health and when women are better educated, the health of the community improves. Women are often the gatekeepers in the family. They manage the health of the family. They manage the health of the children. They manage the health of the husband. I know my wife does. So, So women are often the key to improving health. But when the government is spending more money, they're concerned more about population health than individual health, even though individual health also has to be taken care of. This is only going up to 2020, but as I said, what I have seen, but possibly more related to COVID, that has continued to go up, actually. Yes, the mandatory spend has been removed, but I don't think that will stop the national government spending. The BPJS budget is kind of bottomless pit, so that will take as much money as anybody can throw at it, really. And then the question is really more in the local governments, because local governments are responsible for local services like district hospitals and puskesmas and outreach, and all of that comes under the local government. And what we have seen is that it varies a lot across Indonesia. Indonesia is a very varied country. I might come to that in a moment with a couple of the other charts. What you see in Jakarta or Denpasar or Jogja is not what you see in West Sulawesi or NTT, right? It is a different situation altogether. And even from district to district, we did. The Ministry of Health asked us in our program to do some feasibility study for Pak Budi's integrated primary healthcare reform. So we worked with the what do they call it, the BKPK, the Ibu Liza's group, to do what we call the activity-based costing, to look at the feasibility. And part of that was looking at, well, how much money is actually coming from the local governments? Because if you're going to have not only puskesmas, but you're also going to have pustu, and then other outreach services. And pustu at the moment is very sort of patchy. Some places they have some, and some places they don't. But Pak Budi wants to have pustu everywhere, as a universal sort of midway point between the puskesmas and the community. So we did that costing, and that meant we also had to look at how much local governments are actually allocating to the health sector. And we did a study across a number of districts, about 20 districts across 5 provinces. And we saw a huge variation. And not only variation from district to district, but variation from year to year. One year, a government puts 20% of its money into health. And the next year, it's 2%. There's no rationale to it at all. In some of the districts. Some are more stable, but some are not. So I think that's a critical area. Where the removing of the percentage might be problematic in terms of local government. But we'll have to see what happens. Yeah. Yeah, so then again you see like some countries like Vietnam quite, fairly consistent there. Now we add in the richer countries and you see again different, right? So Australia, the UK, and the US, they typically spend, 18%, between 16 and 18%. The US even more. US typically higher. But in general, it's a higher expenditure. And you will find the same across the OECD countries, across the European Union. In general, the countries with better performing health systems, they typically spend, at least 15% on health. Whereas here with the middle income countries and the low income countries, it is much lower. Now, here's another interesting statistic, which I think is quite interesting in that it doesn't actually throw up anything very significant in terms of correlation with the performance of health systems. Now, you get poor countries like Tanzania and Nigeria, not really a poor country, but poor performing country, with very few hospital beds. Indonesia is still quite low in terms of the hospitalization of the health sector. That is quite interesting to see. Despite the improvements that we've seen, not a big growth in capacity of hospitals in Indonesia. This is up till 2020. India has been sort of on the downward trend. The United Kingdom, it sits in there, right? So the UK, for all of its National Health Service and everything, and what I was talking about earlier about, waiting lists in hospitals and so on, I mean, perhaps, part of it is because for many years they have not invested. The NHS was fantastic when it was started back in 1950, but since then the investment has not kept up. And certainly over the last 15 years, when we had a conservative government all about austerity and not putting any money into services, it's got worse, right? So, the hospital beds per patient, despite the fact that it's a rich country with a national health service, is below what we have in Thailand and on a par with Vietnam. So, there's something going wrong there, for sure. Australia doing, better in general, keeping a higher rate. And then what about China? I mean, that's rather extraordinary. Now, I have read a bit about, the performance of Chinese hospitals. And, of course, I was working there a few years ago. They have invested a lot in hospitals, and you can see that. There are more than 5 beds per 1,000 people, which is very high by global standards. But how efficient is that? If you talk to health economists at the World Bank, and they are concerned about this issue also in many countries, for many kinds of conditions, a hospital is not the most effective place. It's not cost effective. There are some things, yes, obviously you need to go to hospital. But a lot of hospitals, when the system is not well regulated, there are a lot of conditions being treated in hospitals which could actually be handled in primary healthcare. And that's why, in China, they are actually not, they have improved, but it's not considered a very efficient health service. Okay, so I should limit the time. Yeah, that's fine. I'm happy to chat and just go on and give some more anecdotes as you like. Okay. And another statistic, there's not such good data available on this, but medical doctors per 10,000 population is another interesting comparison, right? And we find in all of these countries, this is from 2019 to 2022. So here we're stretching across the pandemic. In almost every country, it's coming down. That's interesting. What's going on there? Are people leaving the profession, or maybe people are not being trained fast enough to keep up with people who are retiring? But in almost every country, including Indonesia, the ratio has been coming down. This is WHO data, so it should be quite solid. This is what countries report to WHO. Or, I don't know, the population growth is not that fast. And in some of those countries like Australia, I mean, there's not really very significant population growth at all. So what's happening? But again, apart from the fact that they are all declining, the other thing that stands out to me from this chart is that all the countries are very similar. Yeah? Whether you're talking about a very poor country like Tanzania, or a richer but poorly performing country like Nigeria, or wealthy countries like Australia, the UK, United States, I mean, the doctors per population are almost the same in every country. That's rather interesting. Yeah? So clearly, you know, the number of doctors you have is not a factor in terms of the performance of the health system. It's just not. Now, quality of doctors might be an issue. That could be an issue. Certainly, I have seen in some countries questionable quality of doctors. But the numbers is clearly not an issue, right? So, what are the issues? You know, when you look at the performance of the health system, we've looked at the financing, looked a little bit at the numbers of personnel, but then it comes back to sometimes, you know, what you guys are involved in, which is the whole area of governance and management. That is an important issue, right? How effective is the governance? How effective is the management? That would be, you know, another important thing to look at. I should wrap up in a minute or two, but I can say that, you know, going into government hospitals in a number of countries that I have been in, you know, a lot of it comes down in the performance of the health system is not so much about whether you have fancy equipment and all of that. You will need that at the top end of the scale, right? But in general healthcare terms, in terms of your average sort of district hospital or provincial hospital and so on, it's really about how the place is managed and about how, about the kind of softer skills. Do people care, do the service providers care about the patients? I didn't mention Nepal on here because it's not a very big statistics and it's somewhat similar to India, but I worked for some years in Nepal, in the health sector in Nepal. And in those days, that was a long time ago, they did not have their own medical training. And most of the doctors were trained either in India or Russia. And I was working at the time with a medical doctor, and we were training people to do actually TB control, tuberculosis control. And we worked with a number of Nepali doctors. And my medical friend, I'm not a medical doctor, but my colleague, my medical colleague doctor, who is a Dutchman from the Dutch health system, Netherlands health system, which is a really, really good health system, and he was trained there. He said, as soon as I start to work with a Nepali doctor, I know exactly, without asking him, whether he was trained in India or in Russia. I know. I asked him, how do you know? He said, the doctors trained in India are technically knowledgeable and competent and very good. But their care of patients and their bedside manner is horrible. The doctors trained in Russia are not as technically competent, but they are very good with the patients. They really care for the patients, they have that kind of empathy with the patients and so on. It's a different approach, right? Just because of where they were trained, right? The thing is, you need both, right? You need both. Don't think that if you're running a hospital, you can make do with everybody who is fantastically well trained and knows their job from a technical perspective. They also need to have the soft skills. That's really, really important. When a woman comes in, I've seen this happen in Indonesia as well as in other countries. A woman comes in and you're conducting an intimate kind of examination which involves her at least partially undressing, and you've got other people sitting around. I mean, come on, that is not a good way to deal with a woman in a health facility, but it happens. I've seen it happening, even here in Puskesmas. And I mean, in Nigeria, I mean, this is a bit funny and a bit rude. I hope you won't be offended by this, but I mean, we were looking around a hospital. This was a district hospital, and the doctor was taking us around, and there was a patient on a bed, and we were a whole group of like 20 people, and there were other patients in the room. And the doctor comes on and says, "You see, I have just performed this procedure on this patient." He whips the bed sheet off him, so he's lying there completely naked in front of all of these people, and the doctor is talking about the procedure. This is not appropriate, right? This is not appropriate. So, you know, even, I'll tell you another anecdote. 10 years ago when I was in Indonesia working for the Australian Embassy, I was on a field trip in NTT province, and my daughter was with me, and she was 10 years old at the time. Now she's 20 and she's studying at the University of Melbourne Biomedical Sciences, but she was 10 years old at the time, and she was with me, and she went to a hospital with me in NTT, one of the district hospitals, I won't say which one. And we were walking around, and you know, afterwards we had a meeting, and during the meeting, one of the people there asked my daughter, "What's your impression of the hospital?" And she was always quite a bold girl. So she spoke up and she said, "Very nice hospital, but two things I want to suggest." This is a 10-year-old. Two things I want to suggest. First of all, you are talking about healthy food and nutrition, but in your shop in the hospital, you are selling nothing but junk food. This is not very good.
This one maybe as well.
And secondly, I saw when you are examining patients, the door is open and there isn't even a curtain. You should at least have a curtain. And this is my 10-year-old Vietnamese daughter. My wife is Vietnamese. She was actually brought up in Vietnam, but she understands that, right? These are some basic things that make people feel more comfortable or uncomfortable with the health service. Do we have the communication skills? Do we communicate? You know, as a foreigner here, I'm covered by health insurance, and we go to the ISOS clinic if we have any issues. I notice the difference between different doctors. They're very good top doctors, right? Consultants and, you know, well-trained GPs and so on. You know, with one doctor, he examines you and he writes a prescription and he says, "Okay, there you go, get your medicine." The other doctor, when he's examining me, he explains everything that he's doing. Okay, now I'm just listening to this part, and if I put my stethoscope here, I hear this valve of your heart. And if I put my stethoscope here, I hear this valve. And he explains it, and then he says, "I see nothing wrong there, and I think in your lungs also, and mostly clear, maybe a little congestion is around here," and so on. So he's going through explaining everything, which is, you know, again, really a best practice. Now, depending on people's level of education, you have to, you know, wonder how much you are going to tell them. You don't want to go over their head and scare them with all kinds of stuff, right? But at least communicate. Say what you're doing. Say why you're doing it, and all of that. You know, it's about the softer skills of communicating, because, you know, if you go into a hospital in Australia, that's just a given. That, you know, staff are not considered to be doing their job if they are not communicating properly with you, explaining everything that is happening, asking your consent, etc., etc. They have to do that all the time. In fact, they would, you know, they might lose their job if they don't do that. You know, it's just part of the system. So that's, you know, something that we need to bear in mind. It's not just about the technical skills. It's about the soft skills, and that makes a big difference to how the health sector is run. And even, which I think goes back to some of the experience in places like China, maybe 20, 30 years ago in China, where China had not a bad health system, not one of the best either, But one of the things they did was they made sure that the system was user-friendly. And people who were even not fully trained medically at least knew how to handle patients and how to deal with the patients. You know. So these are some of the things that I think would be very, very important when we look at the health systems in different countries. This is again something we can learn from Thailand also. Thailand with very good health system and getting very good public perception of their health system. Because not only are they technically good, but they also are user-friendly. And that's a really, really important aspect of you guys managing hospitals. How user-friendly is your hospital? Technically should be excellent, yes, and I'm sure it is. But how are our soft skills? Okay, I think.
Please stay on me. Okay, you can take rest for a while. Thank you, Pak John. And this is for you also. Because the one that, terima kasih. Kita akan ada di sesi diskusi tanya jawab. We come to the question and answer. Silakan bila ada yang ingin ditanyakan. Namun sebelum dari audience, one thing that I get from my experience when I handle the health tourism in MOH is that I also would like to ask your view on this. Is about the certainty from many hospitals in the world, certainty of time, certainty of money they have to pay for the services, and also the quality. That's why many of Indonesia, especially the middle income group, went to I would say health services in Malaysia and also in Singapore. So that's something that I found in this experience during my time in MOH. So what do you think, based on that ranking in the first slide, that one, what is your experience when you get the, let's say, I had experience get the health services in Korea, for example, in Seoul, and in Tokyo and Singapore. So the certainty of quality is there. And how do you compare in Indonesia and Vietnam and also Thailand?
Yeah, thank you. That's a very important aspect, right, is having confidence. You can improve your health services, but if the public don't have confidence, it might not help you very much, right? So you've got to have that confidence built up. Part of that comes from what I was just talking about in terms of the bedside manner, if you like, the ability to communicate clearly. So coming with that, the expectation. So in some countries, and I think maybe in Indonesia, in some places they do this, right? They post up, a notice. These are the services that you can expect. And if there is a fee for payment, then these are the fees that you will pay, and they publish that. And in some countries where corruption is a big problem, like in some countries in Africa, that's really important. Because, the doctor will charge you 2-3 times, but then the patient, if they are literate, can say, well, actually your notice says, this will only be so much. Why are you charging me more? And then, there is then supposed to be some kind of a feedback mechanism where they can complain or whatever. So there needs to be a clearly set out, expectations. These are the services. If there is a fee for payment, then these are the fees that need to be paid. Similarly with, any health insurance scheme, it needs to be set out clearly. What are the benefits and what are the limits to the benefits, right? And there should be public education about that. Because, any of us who take out private health insurance, we know that, the fine print can run for 20 pages or more. And most people in the villages, and in the poorer parts of the cities, they're not going to understand all of that. So it needs to be communicated in a simple way to them. So, there needs to be clear communication about what are the expectations. What is the service? And what is the price, if any? And if something is wrong, what is my process for complaint? You know, there could be a complaint box, a suggestion box, some things like that, or there could be a phone line, you know, where people can phone and say, you know, what their issue is and so on. So different countries, depending on the technology and so on, do that in different ways. But it should be fairly clear that these are the expectations, and then it's up to the individual institutions to build their reputation, right? So, you know, obviously a hospital like you are running here, or Siloam hospitals or so on, I mean, they have their reputation and everybody goes there, right? And you know that if you can afford it, you go there, right? With the government hospitals, it varies, right? And some have better reputation than others, and you know. And sometimes I've seen in some provinces, people might go to the next district because they know the hospital there is better, right? So it's also up to the management and the staff of the hospital to build their own reputation, because there is, as you know, big information asymmetry in the health sector. Patients actually don't know whether they're getting a good service because it's highly technical. Right, so you need to manage that by providing the necessary communication so that people at least feel satisfied. They might not, you know, actually understand, but at least that they feel that they are being listened to, they are being cared for, and that will definitely enhance the reputation of the institution.
Thank you. Silakan bahasa Indonesia nggak apa-apa, bahasa Sunda juga bisa. Saya orang Sunda. Nanti kita ini silakan, mungkin Dokter Mul ada, silakan. Saya sebetulnya untuk student menyiapkan ada gift untuk yang ini ya, ada sponsor nih, ada sponsor, silakan.
Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Pakai bahasa Sunda boleh ya Pak Diki ya? Ya, saya dari mahasiswa ARS Pak, angkatan kedua. Ada 2 pertanyaan Pak Diki. Yang pertama, tadi Pak John menyampaikan bahwa ada grading ya, peringkat-peringkat itu. Kalau kita ketahui tadi Pak John juga udah saya rasa sudah berkunjung ke private hospital di Indonesia. Tadi Medistra, Pondok Indah gitu. Kalau kita lihat ya, di Indonesia ini untuk menggrading kalau memang basic datanya dari pasien, untuk private pasien tidak melihat macam-macam saya lihat. Yang dilihat adalah dokternya gitu. Misalnya kita mau ketemu Prof. Chandra gitu. Jadi kalau Prof. Chandra di Persahabatan, kita kunjungannya ke Persahabatan. Atau kalau Prof. Chandra di Pondok Indah, pasien akan mengunjungi di Pondok Indah. Apakah itu mempengaruhi dari tingkat grading tadi? Yang pertama. Yang kedua mengenai government expenditure of health, tadi disampaikan juga Pak John sampaikan. Apakah yang dimasuk expenditure dari government ini, apakah hanya terbatas pada pembiayaan public insurance atau JKN, ataukah total dari budget yang dikeluarkan oleh Kementerian Kesehatan? Karena di samping public insurance, Kementerian Kesehatan juga mengeluarkan budget untuk pemeliharaan kesehatan juga gitu. Dan apakah jika kontribusi dari budget ini dimasukkan ke public insurance akan meningkatkan pelayanan di public in health? Itu aja Pak Diki, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Ini agak panjang.
The first question, absolutely true. And I think, as I gave an example from, again, a private facility from ISOS, where I am, because of my health insurance policy, I am supposed to go there. Different doctors, different approach, right? If I was all the time seen by the first doctor, probably I would not have a very good impression of the ISOS, If I was all the time seen by the second doctor, I would have a very good impression of it. So it depends a lot on the individual. And I think that comes down again, perhaps more to hospital management, but that is a challenging area. Because, let us be really realistic about this, doctors are highly qualified people who have spent many, many years on their education. And many of them are alpha males. Some might be alpha females. They're quite dominant, right? And hospital administrators often, if they are not doctors, are a bit scared of the doctors, frankly speaking, right? So difficult to manage, but and again, this is different management practices in different countries. So in the US and the UK, for instance, very different. Hospitals in the US are almost always managed by professional managers, whereas hospitals in the UK tend to be managed by doctors who have been over-promoted and who are not managers, and often struggle with management because they're actually doctors, right? So, it is an issue that comes back to hospital management. How do you make sure that all of the doctors are behaving in a way that attracts the patients, right? Their technical skills may be very similar, but the patient's impression, because of the information asymmetry, the patient's impression is largely about how they have been treated. Whether the doctor has made them comfortable, whether the doctor has reassured them, whether the doctor has, addressed their concerns, that's what they're worried about. They don't know whether they've got the right medicine or not. They are not qualified to judge that, right? So hospital management really needs to ensure a culture of patient care, regardless of the quality of the technical treatment. On the second question, yes, all government expenditure is included. I don't know if you're familiar with national health accounts, or can be district health accounts. National health accounts, they look at the source of the money as well as the channel of the money, and it can be hybrid, right? So like in the National Health Service in the UK, the government is both the source and the deliverer of the service, right? And there is very little health insurance. There are some private health insurance, right? In Germany, the source of the money is the health insurance, which comes mostly from companies, right? But the provider could be a government hospital, could be a private hospital, right? In Indonesia, again, you have a hybrid system. So when I gave these statistics about government health expenditure, that includes the health insurance that is funded by the government and the direct expenditure by Ministry of Health, which is significant, right? Ministry of Health runs some big hospitals and does a lot of other stuff, right? So Ministry of Health has a big budget, but the BPJS also has a big budget, right? So it's split between the two, and both are included, yes.
Silakan bila ada lagi. Saya akan menambahkan juga bahwa Dr. John ini juga MBA dari Cambridge ya, and graduate from Cambridge University, jadi Master Business Administration. Silakan, ada lagi? Mungkin dari Dr. Mul atau?
Terima kasih Pak Diki. I just to comment related the Pak Diki question to you, Mr. Jones. Really, most of Indonesian people come to our neighbor country, let's say from Malaysia and others. But there are three classified of them. The first of border country, most of Sumatra and others come to Malacca, and from North Sumatra come to Penang. The reason of them come to their country because the pricing in the hospital is cheaper than Indonesia. The main problem is why the pricing is cheaper, because all of medical device without tech anymore. And the second one, community in Jakarta come to Singapore, Kremon others Singapore. He want to get second opinion related to the service in Indonesia. And the third person, they are going to make clinic to others, is a person who we will to mindset should be to go to the hospital. So I think one of reason our divisa go to abroad with the reason. But the important thing related to healthcare expenditure, because of Indonesians medical device is so expensive than our country. Even Malaysia, Thailand, and Vietnam, and others. And the second one, maybe I want to ask. Previously, I quite well known related of national health insurance in Australia. As I know that many of Australians come to Malaysia because they can to use of national health insurance directly as a Commonwealth countries. As I know that the pricing of national health insurance compared the hospital pricing is not quite different, just less than 20%. Do you have any comment related?
Yeah, these are quite complicated issues. I come to the last point first. Australia has a hybrid system, right? And a lot of the healthcare is provided under the national system called Medicare. But Medicare has limits. It is not like the National Health Service in the UK. So I noticed a big difference moving from the UK to Australia. In the UK, whatever I have, any kind of health issues, I go to the GP, or the GPs are the gatekeepers, right? And unless you have an emergency, you cannot go to the hospital, right? You have to go to the GP. The GP then refers you to the hospital. That's the way it is under the law in the UK. Only the hospitals will only take patients directly off the street if it's an emergency. But other than that, you have to go through a GP. But whatever I want, it is free. I mean, I pay a prescription charge if I'm taking medicines. I pay a sort of standard fee. Regardless of what medicine, the fee is the same. Okay, it's just a basic surcharge. In Australia, the system is quite limited. There are a lot of things that are not covered under Medicare, and usually with Medicare you get part payment. It's a co-payment system. Medicare is not covering like the NHS everything. If I go to a hospital for treatment and go to my GP, then I get referred to the hospital in the UK, unless I'm buying medicines, I don't pay anything. I go for an X-ray, I go for a lab test, I don't pay anything, nothing at all. In Australia, I have to pay for all of those things. I don't pay the full cost, but I pay part of the cost. So that's why, you know, if you see another country that is in the Commonwealth and has reciprocal arrangements with Australia, which has a reasonably low cost but quite good health service, maybe Malaysia, maybe Singapore, actually it makes sense for some Australians to go there. Because in Australia, they're having to pay quite a bit, actually, depending on what the procedure is. So it's only partially subsidized in Australia. Sorry, the first question was about the Indonesians going to other countries. Yeah, I think, you know, you're not going to be able to compete anytime soon with Singapore. You know, Singapore is ranked consistently one of the top countries in the world for its health facilities. So if people have the ability financially, they will go. You can't stop them, you know. But Malaysia may be different because, as you saw from some of the charts, you know, Indonesia is catching up, right? I think, you know, a few years ago, Malaysia was quite well ahead of Indonesia, but there's not so much difference now. And it will vary a lot on the hospital. Some of the government hospitals now have well-recognized international accreditation. I think, actually, there was the what used to be called the Sangla Hospital in Bali was the first government hospital in Indonesia to get that international accreditation. Now there are many. Of course, there are non-government hospitals, but now there are many government hospitals. But I remember, I think Sangla was the first one. So there are hospitals. They need to build their reputation, right? The thought is still, it'll be better in Malaysia. The reality is, actually, it might not be better in Malaysia, but there is a cost issue. Now you raised the issue of cost. If it is covered under health insurance, that should not be a big issue, but that's a problem for the BPJS, escalating costs of the BPJS. And one of the issues, I mean, we could get into sort of political territory here, but one of the issues is that import procedures and regulations in Indonesia are very difficult, right? So if you're talking about importing stuff, importing equipment, importing reagents, and so on, it's very expensive. And that is to do with Indonesia's import-export regulations and how that works. For instance, I'll give you an example. We have been supporting the establishment of Pak Budi's BGSI, the Biomedical and Genome Science Initiative doing genome sequencing. So right, it's at the Eichmann Institute, they have all these machines, they're doing the genome sequencing, they're doing biobanking and all of that. So we provided the senior technical advisor, who is an Australian-Indonesian, Dr. Ines Atmosukarto. She has been supporting that process. So she's based in ANU in Canberra. She told me it is horrendous what Indonesia is paying for reagents. To run genome sequencing, you have to import reagents all the time. She says, I thought these are procured on the international market. So I do this in Canberra in Australia, so I know what the international cost is. I was horrified. In Indonesia, you are paying more than twice what I pay in Australia for the same thing, because of the way the import works in Indonesia through different agents and all of that. Everybody takes their cut and so on. So you end up paying a lot. That's an issue which, you know, has to be dealt with at a higher level. Even the Ministry of Health cannot manage that, right? It has to be Ministry of Finance and, you know, the President. People like this have to get involved. Otherwise, that's going to be a continuing problem.
Thank you, Pak. Akan ada dua terakhir pertanyaan. Satu dari kelas, satu lagi dari online. Mungkin, silakan.
Baik, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Mr. John, for your explanation. Really appreciate for it. First question I would like ask regarding regulation. What do you think if compare regulation between UK, Africa, South Asia, and China with Indonesian? I want to know how much regulation if compare it Indonesian, because some regulation in Indonesia really rigid and really too much, yeah. Okay. Second question regarding Sharia regulation. Is there any Sharia regulation, Islamic regulation in UK, Africa, South Asia, and China? Because in local regulation in Indonesia comply to fatwa MUI, Majelis Ulama Indonesia. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Yeah, thank you. Good questions. On regulations, every country has its own regulatory environment. Some of them are a bit over the top, some of them not so much. But very often it comes down more to how well they are enforced. You know, regulations are there for a purpose. And, you know, you don't want, let me give you an example in the pharmaceutical sector. You know, the pharmaceutical sector is a sector which in every country is regulated. But in some countries, nobody enforces the regulation. In other countries, it is very strictly enforced. So, for instance, if I want to treat myself, if I got a fever and I found that I've got, you know, some disease, or maybe I got a wound and the wound became infected and I've got an infection and I got a fever, I want to take an antibiotic. In some countries, you can just go to the pharmacy and buy an antibiotic. The rule might say you can't, but that doesn't stop you from doing so. In India, there is no regulation at all. You just go and buy it, right? In Indonesia, it's a bit mixed, right? Yeah, some places you might be able to get it, right? But in Australia, or even in Tanzania, where they are now very strict, or in the UK, there's no way you are going to get that without a doctor's prescription. Now, question is, can you forge a doctor's prescription? In Bangladesh, I also worked in Bangladesh, there is a big business in forged doctor's prescriptions, and even some of them may be genuine. You just pay the doctor for a prescription. He's not going to examine you. You say, I want this antibiotic. He gives you a prescription. You pay for the prescription. So there is a black market going on in in prescriptions. So it depends on how well the regulation is actually implemented. Whether you have rules or not is a different matter, right? And I think in Indonesia, in some areas, the rules might be too much. But again, are they being enforced? That's a question, because the rules should be there for a reason. In terms of Sharia law and Islamic practice, most of the countries I have mentioned do not have that because they are 100% secular countries. China is quite anti-religion. Vietnam is quite anti-religion, so they will not have anything to do with any religion officially. Unofficially, people practice religions, right? But as far as the government is concerned, it's very non-religious, right? India, they have a mishmash, right? You have more Hindus, but you also have Muslims who stick with Muslim practice, and that is recognized and accepted. In the UK, by law, you cannot discriminate according to religions, but if you are running a facility that follows a certain religion, you are allowed to follow those religious laws, right? So if you are going to run an Islamic hospital in the UK, you are allowed to do that according to Islamic law. But if you are a government institution. A government, you're not allowed to do that. Nigeria, they have Sharia law in some states. Okay, so and Nigeria is a fairly decentralized country. It's a kind of federation of many states. And up in the north, the Muslim majority states, some of them have Sharia law, some of them don't. In the south, they are majority Christian, they don't. Right? So it varies from... The situation is different in different countries. But in most countries, the national government is non-religious. It's only in maybe Arab countries that you will find is different, a few countries are more overtly religious. India is becoming more Hindu under the current prime minister. They are becoming more and more Hindu, whereas they used to be, like Indonesia, where Indonesia is not officially an Islamic country. You have 6 religions, right? But you are free to practice your religion, right? Some countries you are not free at all to practice a religion, right? So that there are restrictions. Yeah.
Thank you, John. The last question, the last question from, since we have also Zoom participant, please Dr. Evan nyalakan itunya kameranya, silakan menyampaikan pertanyaannya.
Halo.
Ya, silakan.
Ya, baik. Makasih Pak Diki. Thank you, Dr. Lee, for delivering such an extraordinary lecture. But I cannot open my video. Is it okay?
It's okay.
Okay. My name is Evan Sastria, Dr. Lee, GP at ERC Hospital, and also a final year student in the hospital administration program at ERC University. Dr. Lee, we might agree that BPJS can be considered one of the largest insurance system in the world right now, with over 200 million participants currently enrolled. And however, we also understand that BPJS largest expenditures are allocated to covering non-communicable disease, right, such as heart disease, cancer, stroke, kidney failure, and others. And on the other hand, BPJS doesn't conduct underwriting for its participants, right? Meaning that all residents can join the program without any clinical condition assessments. So, Dr. Lee, from your perspective and experience, how do other countries manage the enrollment of participants in their national insurance system? And in your opinion, which country has the best enrollment system? That's it. One question. Thank you.
Thank you, Dr. Evan. Silakan.
Thank you. Yeah, very, very good question. I think, yes, probably BPJS is one of the largest. It's not as big as China. China, they used to have 3 different systems, but they have been bringing them together systematically. They used to have 3 different systems. One was for the civil servants and formal sector employees. One was for the urban population, and one was for the rural population. So they were 3 separate ones, but they are now working towards making the premiums and the benefits the same. Over a period of years, they are bringing gradually, the rural one was the least benefits and lowest premiums, and they are gradually bringing it up to match the other ones. But that was the biggest one. And in China, as I said earlier, you can't disagree with the government. The government says you enroll in health insurance, you enroll in health insurance, right? There is no option. Everybody is enrolled. It's a compulsory system. Now, there is, of course, risk when you are enrolling people who have pre-existing conditions, but that's part of the calculus in terms of the way the Chinese government runs it. They accept that. Okay. They want everybody to be covered. Okay. Typically, with state-funded insurance schemes, the aim is for everybody to be enrolled, regardless of preconditions, but they want you to declare those so that they are aware of your situation and they can factor in the risks. In terms of private insurance schemes, of course, they're going to put up your premiums when they think that you are a greater risk, right? But with the government systems, typically they don't do that. I think I've alluded to the German system. I haven't studied it for a few years, so I'm not sure how it's going at the moment, but certainly when I was looking at those things maybe 20 years ago, I would have said the German system is probably the best, but they have others in Europe. In general, the European mainland countries, places like Netherlands, also Scandinavia, Germany, some of these countries probably have the best systems. But they aim to have universal enrollment, that's for sure. Yeah.
Thank you. Thank you, Pak John, for very insightful and also infallible lecture. Please give applause to Dr. John. Sebelum untuk penutup, bahasa Indonesia deh. For the last session, please, Pak John, Professor Chandra, as the director of this postgraduate, will give you the souvenir. Dan Pak Mulyadi mohon menemani Pak ini nanti di depan, silakan. Ada foto itu ya? Oh, Bu Yanti temenin dulu. Bu Yanti ya, temenin Pak Prof Chandra sebelah sini, oke. Dari mungkin Pak Mulyadi boleh? Ya, silakan. Sebentar. Sekarang di sini, please change the position because the student also will mungkin merapat aja. Sorry. Merapat. Oh iya. Ini nggak bisa ya. Kami nonton drakor tuh ya. Terima kasih semuanya. Assalamualaikum warahmatullahi wabarakatuh. Ya, terima kasih ya.